Billy. Good morning. We
Good
didn't have
morning.
for to be
How about it? Yes.
and inquire minds. Wait a minute, let me. I hear echo. And inquire minds need to know.
Yes. We got questions.
Hilarious. Okay, let me get. Sorry, you got me tickled over here. Just tickled. Okay. Well, welcome. So, how's it going this week?
Oh, I had a week.
Oh, you had a week.
Did
Ooh.
you read that long text I sent you?
Yes, I saw.
Okay.
Yes, you had a week. You had a whole week. Oh, but is everything okay? I mean,
It's
you
getting there.
okay, okay. Like, what is always going on to somebody? Was everybody okay? Nobody was hurt?
No.
Okay, well, that's
Nobody was home except the dog, and the fire department got the dog out.
okay. Okay. Well, that's a blessing. Oh,
Mm,
that's scary though. Imagine. And you were
yeah.
home.
Yeah, I was sitting in the kitchen with the door open, and I thought it was raining at first. I see all this. I didn't know it was smoke. I just thought it was like a mist of rain. Then I started hearing all this banging, and I'm like, and it wouldn't stop. So I said, let me go to the door and see what's going on. And that's when I smelt it, and that's when I saw it. So I grabbed my important belongings and ran across the street to my best friend's mother's house and left my. I was over there with her, and then it just devolved into chaos because then it just like you can hardly see outside.
Oh my God. Oh my God. That's crazy. Well, I'm glad you are safe and you are here and
Yes.
all is well. No glitches. We ain't have to get nobody for foolishness and all of the things. So
Mhm.
I'm glad that that worked out. All right, all right. So let's get this puppy started, I guess. All right, all
Yep.
right. Well, good morning, everybody, and welcome to our Saturday morning tea, where we discuss health information, news, education, certification tips, entrepreneurship, uh, physicians.
Oh.
God. Oh, and I have a whole that's I should have made that a whole show. This conversation I had with a physician the other day. Ooh, child. But anyway, entrepreneurship and the revenue cycle at large. And as you come in, don't forget to hit the thumbs up or like button for the engagement. We love your engagement. I am Clarice Warner. I am the girl with the pearls. The I need to bring a whole bunch of pearls. I felt like being Grant. Could you tell with the scarf?
Yeah.
Felt Diana or somebody in my spirit. Anyway, Warner, the girl with the pearls, the founder and senior education director of the Professional Reimbursement Network, LLC, where coding education is key. PRN is a healthcare compliance consultancy located in Cincinnati, Ohio, that specializes in revenue cycle and regulatory compliance and education. One of the things that we pride ourselves on is making sure if you have an interest in the medical coding field that we provide you with the information and the tools to successfully pass a medical coding certification exam prayerfully, and if you follow me, the first time. All right, all
That's
right.
right.
So let me ask you, do you know what it takes to be a certified marketable medical coder? Well, before I introduce my co host, let me share with you information on a free email course on the 5 steps. Yes, 5 steps. And yes, it's free to become a certified marketable medical coder. Are you interested in medical coding, but not sure where to start? And scared of wasting time and resources? Let me help you with the right steps to become a certified marketable medical coder. Learn more at bit.ly/5stepscoder. You know it happens every time. Let me turn this down. Okay. Because every time y'all catch me doing my little jig. Because I love music. Anyway, if you are in Clubhouse, feel free to click the link. If you are interested in getting more information about the 5 steps to become a certified marketable medical coder, and if you are joining us via YouTube, Facebook, and or LinkedIn, you can find the link in the description. I know it's a lot of stuff in there, but trust me, the link is down there and not far at the bottom. It's kind of close to the top. So joining me today is my co-host, Mr. Jesse, the registered trademark. Put some respect on his name, the coding nurse. Sir, introduce yourself and tell the folks all about you.
Good morning. My name is Jesse. I live in Philadelphia, Pennsylvania. I have been in the healthcare field for 30 years. In 2014, I transitioned into the wonderful world of HIM. In 2020, I created a company called the Coding Nurse LLC, where I help nurses and other healthcare professionals with clinical backgrounds transition into the wonderful world of HIM.
And how is that going?
Great so far.
Good, good. I love it. I love it. All right, all right. So before we get started and talk about all the things that we got to talk about today and the tea that we're going to spill today, let me remind you that this is a conversation, and we want you to join in and add to that conversation. Of course, if you're on Clubhouse, you can just raise your hand. We'll see you. We'll bring you to the stage. If you are joining us via Facebook, YouTube, LinkedIn, you know what to do. You use that chat, put your chat comments and questions or concerns in the chat, and then we will definitely respond. If you type a Q first, let us know that it is a question. We'll look for those cues, and then we make sure that we don't miss it, and we can answer your question. So again, don't be shy. Your opinion matters and is welcomed here. Good, bad, or indifferent. You know, everybody has thoughts and opinions and concerns about things, and this is a space where you can actually talk about it. So for those who are joining us today or watching the replay, today we're talking a couple things, some scope creep battles that have hit the scene recently, and a new place of service code that will be effective in October. But first, before we get into all of that, actually, my church announcement, I should have made it into a whole segment because, it's a whole lot going on out here in these streets. So let me get my. So we had a question, a burning question of desire. And if you know this, please put it in the comments. If all churches, all denominations of churches, you know what the church brand represents. In the comments, I know I visited the house in Vegas. You know about the church. Churches or racial makeup happen. I'm not 100%. They got we're curious.
Yeah.
This has been going on for a minute. Let me just say this. So, if you are a member of AHIMA, this directly impacts you. So listen up, Buttercup, because this is going to go down. All right. As you know, in October, and I do believe, I didn't check with anybody for certain, and I do believe I have liberty. I'm not saying some of the things verbatim, so I'm going to generalize, but let me just give you the rundown of what's happening in these AHIMA streets. So in October, the national meeting will occur, and the House of Delegates always meet prior to the start of the conference. Oftentimes at the House of Delegates meeting, and you have elected delegates in your state to represent you and your interests as it relates to HEMA. Depending on the size of your state determines like the number of delegates you have. I think there are 4 of us here. Some states have more, some have less. It just depends, I think, on the size of your state. Some of the things that we vote on at the House of Delegates meetings include proposed bylaw changes, changes in some operational, not a lot, but some operational things. Sometimes they're just providing us with information, not necessarily up for a vote. But usually it's really all about kind of the bylaws and what occurs related to that. And last year we had a lot of bylaws and all of them were approved but one. And usually when there's some issues and folks are not feeling some of these bylaws, it's a beautiful thing. When I tell you, it's like going to the open tennis match, because we looking back and forth. Folks is running to mics. Folks is giving a passionate plea for or against. It is a whole thing. They always preface all the meetings with Robert Rules of Order. So they have a parliamentarian there. Legal is represented. It's a whole thing. And when I tell you it's serious, it's serious. So one of the things, and the reason why I bring this particular item up to you all today, again, this is primarily for those of you who are HEMA members, because it directly impacts you. It hasn't been really sitting in my spirit real well for a lot of reasons. And I'm going to actually reach out as delegate and president of my state association directly to say, hey, I want to hear from you all. I want to know what your thoughts and feelings, because this represents you. And I want to make sure that we're coming in and providing a vote that encompasses that representation. So one of the bylaws is bylaw 5.5, and it deals with the election and term of office. And it speaks directly to the board of directors, HEMA's board of directors. So currently, the members elect the board of directors, and they're elected for a 3-year term. After 3 years, then I don't know if they are able to come back on the board. I think so, but I'm not 100% certain of, and that wasn't part of the change. What they want to change it to is they want the boards to have a second 3-year term. So the members would elect a board of director person. And at the time that person says yes or agrees to that term, they actually have to agree to a 6-year term. Broken down into, it gets better than that. Broken down into 2 consecutive 3-year terms. Now, after that doesn't necessarily mean that they're going to be on there for 6 years, because after that first 3-year term, the bylaws, the way in which they are proposing it, they want the board of directors to determine and evaluate whether or not that director should be appointed to the board for the remainder of that quote unquote 6-year term. So for the second 3-year term. That's where everything went left. The folks was like, wait. Time out. The issues that have been vocalized are several. From the perspective of the board and board of directors, current board members ask for some of the things that they have. One, there find in member voter participation. Um, they mentioned that they don't have enough time to complete their initiative. So you get in, I think that first year or so, you have, orientation to the board. And so once they get their teeth into it's going to be their initiative, um, their program, they don't get an opportunity to complete it. And I think those were primarily the that from before. Um, and they felt like it's because they're working with the board, and the board is seeing them in action. The board should have the discretion of the appointment of whether or not that person extend their term. The members, the delegates, let me just say that. The members, technically, you're trickling this information out to members so they wait. So I have an app or the position is that members elect. If only two members vote, members elect the board of directors. Within our bylaw, members are elect the board. Only members can remove a sitting director. So even a board of director person can't say, "Oh, that person didn't vote." It has to come before the membership for a vote. Um, so the board people also said, "Well, the members are involved because they elect them officially." And members and the delegates are like, "No, ma'am, no, sir. Yes, we elect them officially, but we should be involved in whether or not they did that. So they're putting together some sort of evaluation. No one has seen the evaluation. No one knows what that evaluation is. From the director perspective, to evaluate that person to see whether or not they should get it. So the delegates are like, absolutely not. This is a we have to go. What if, and the president came up with several times, well, what if the the members feel like they're doing a good job, but the board feels like they're not doing whatever reason, and they decide um, to move forward. That's an issue because again, the members, these people are like this week, I vote for then you have the rule in the world wants to do like that's a long time to provide, and you have to say yes. You have to say I'm willing to order according to this bylaw. You would have to agree to yes, I would give the second. Otherwise, so the thought was you're not probably going to get a lot of um, um, volunteers to step up and run for board of director office. The other thing was I mentioned the evaluation form.
I'm just no. Seriously, I just think that this could have been a topic all to itself, honestly. And
Like after I did it, like this gonna take up. This is gonna be longer than the whole church announcement. This gonna take up one of the topics.
but I'm just gonna keep it brief. Like,
We can keep it because the place of service is kind of this. That's real quick. So go ahead, do what you say. What you do.
because for me, like, I mean, because the whole time you're talking, I'm like, you know what? Well, I'm just not going to renew my membership. I'll just pay to keep my credentials because this. I'm just gonna say it. I mean, this is some white lady BS.
And that was another thing that came up. Like y'all trying to make this look like the good old girls
exactly.
Club.
With what is going on in HIM, with them between outsourcing and AI, a lot of us get ready to not have no daggone jobs. And this is what you come up with. You're trying to basically once again gatekeep. Like, I just don't get it. Like, all you want to be able to, so you and your little crew can get together. Then if you don't like somebody or somebody's challenging you, then you and your crew can have them put out, so you can maintain power. I'm just so over the whole gatekeeping and this whole white lady BS with this all backdoor behind the scenes. No, like this organization is crumbling. You don't have participation because you're freaking useless. And this is what you want to do. This is what you try to come up with some kind of game plan to give you power, but not address what the function of the organization is. I'm just over it already. So when they can do whatever they want to do, because my delegate is another useless white woman. So I don't know, if I even want to be. I don't even know if I even want to engage, because when it comes time for me to renew my membership next year, I just freaking won't. I'll just pay to keep my credential active and let that be that. Screw them.
So somebody else. So another thing, and let me add this piece because folks were talking about this as well. So they got this information or this advice to change these bylaws based on an external consultant who deals with other member-driven nonprofit organizations. I believe that's how it was stated. And so folks were like, we don't know who those organizations. Oh, well, they've asked for the names. What organizations y'all talking about? What organizations suggested? What organizations have these consultants worked with that suggested or decided that this was an appropriate change to make? They wanted names. They was asking for names. And of course they were like, well, it may be proprietary. They can't, give out their clients, because everybody was like, this is foolishness. They was like, this is not an organization they felt like it's not an organization like ours at all. And so how can you compare what may be good for one is not good for all? And so again, this one is going to be, I can't wait. I'm going to be sitting, I can't say I'm going to be sitting at the front table because we assigned by the state, but I'm sitting wherever we are, like, whoo. I wish I could bring a camera in, but because it's going to go down.
They're getting ready to lose a lot of members. That's what they're getting ready to do.
Well, it hasn't passed. Let's start there. This bylaw has not passed. It has to go through the process, which again, my ask, if you have a feeling one way or the other, even you can reach out to your delegate or some other. You only got one?
Yeah, I'll have to.
You may have more than one.
Okay, I'll have to look into it because I know.
May have more than one. But just reach out and say, hey, I heard about the bylaw change or whatever. Or if you want to ask them to send you the complete verbiage of that change and the Q&A. There are some more in there too. Most of them were where they had to make some changes in no changes in the language, but typos, or they capitalized the letter and changed this or moved this around. So most of the changes were real minor like that. That one is a big one. And the other one relates to the financial committee. Something about the finance combining the finance committee and the audit committee. And everybody eyebrows have been raised about that. Like, what? Like, most places keep those separate, and they're separate for a reason. So there may be some conversation related to those. But I know the election and term office bylaw was the huge one that we have spent a lot of time talking about. So my call to action to you is to reach out to your delegates. If you have questions or concerns or want to weigh in, so that they know how to, and they may feel like they know, your position and will vote, because they're going to vote one way or the other. But make sure that, if you have thoughts or you want to get a particular message across, just make sure you reach out to your delegate and let them know your thoughts. That's all I'll say on that. Yes. So yeah, I will use. I'll say also, y'all trying to gatekeep. I will keep that in mind, so I can.
That it's ridiculous. It really is. I mean, of all the things going on, I'm just over it.
I'm like you, because we got way bigger fish to fry over here within our profession,
And you
and
trying to make it a power grab, and for what?
And
this is
well, and yeah.
I mean,
my thing would be give some concrete examples of something that was beneficial to the members that came out of the board of directors. What have you done for the members to feel like this is warranted? Why should we trust you, board of directors? I know we elected you the first time because we wanted to change the blood. And somebody did say, at this rate, it's going to look like they called it the good old boys club, but
that's exactly.
In all essence, we know it's the good old girls club, but
Mm-hmm.
it's gonna look like it had in years past. But why? Yeah. So it's gonna be very, very interesting. The conversation, the banter, the back and forth, and the vote. And I'll let you know whether or not.
Please do. Look, you got to keep us posted on the forming of the Metamucil Mafia. These old biddies.
So Mafia. See, I need a timestamp right here. Metamucil Mafia. I love it. I love it. Okay. So that was church announcements. Let's get to the meat. Let's go with the place of service. Let's get this out the way, because Lord knows we're probably going to be discussing the other one. So, as I mentioned, we have a new place of service code that is coming out for October 1, or effective October 1, 2023. And it's place of service code 27. It's outreach site/street. And it's for a non-permanent location on the street or found environment not described by any other place of service code, where health professionals provide preventive, screening, diagnostic, and or treatment services to unsheltered homeless individuals. So that will be a new. And there is a transmittal 12202 that was dated August 10th, that is the focus of this place of service code 27. Now, they mentioned in this transmittal, where did it go? This new code was requested and ultimately created at the request of industry entities. It addresses a need for a code which helps identify care rendered to those who may be unable to access brick and mortar settings, as well as to potentially allow for the tracking of care provided through outreach sites. So it gives the policy related to this change. Now, Medicare has not identified a need for this new code. However, In order to comply with HIPAA and its goals of promoting administrative simplification, contractors are to accept claims containing this new code in accordance with its effective date. Medicare contractors shall therefore implement the systems and or local contractor level changes needed for Medicare to return as unprocessable claims with the new code should it appear on a Medicare claim. So that is coming for you hot off the press, October 1.
But
Go ahead.
that's so odd that CMS has said that they don't, what did they say? They don't. But how can you not see a need for the code, but yet so homelessness as of October 1st is going to be a chronic condition or a CC? Correct. Exactly.
Correct.
How can you not?
They need this additional information to be able to justify or validate the use of it for them. I don't know.
Because it would make sense, because if you can have it as a CC in the inpatient, why can't you have it as a place of service in the outpatient? Because there are people who do receive, services outside of, on the street.
Yep.
So
and if you consider or think about, look at all we went through COVID. Like, people were actually going through street, areas designated to be assessed and get their vaccinations and all of the things. So yeah, when nobody going to nobody's building. So
that's crazy.
And maybe they in their feelings because they didn't come up with it. I don't know. It wasn't my idea, so I'm like, no.
Exactly.
Sticking my feet in the sand. All right. So then the next thing, child. Buckle up. I got 3 tea bags over here. I had to make sure it was strong. Okay. Let's talk a little bit about this scope creep. So the first article that came from the AMA Newswire from Tanya Albert Henry talks about nurse practitioners suing for the right to use the, and it has quote, doctor label. I felt like when I even saw that title, I felt like, what? The first question I was like, what? But this is about those nurse practitioners who's earned the doctorates of nursing practice. And they are suing the state of California, saying that they have earned the right to tout themselves using the term doctor. If I work, well, the nurse practitioners claim there's a California statute that only allows California licensed allopathic and osteopathic physicians to use the term doctor, and doctor is unconstitutional. The restrictions has been on the books since at least 1937 to avoid patient confusion over the level of education their health professionals have achieved. Physicians disagree, telling the court that the breadth of physician education and practical training eclipses that of nurses training, and that the law avoids patient confusion over who is treating them. In addition, physicians tell the court that surveys support patients' need and desire to only allow MDs and DOs to call themselves doctor or doctor. But they don't do that in any other setting. Like, yeah, okay. In an amicus brief, the Litigation Center of the American Medical Association and State Medical Societies and the California Medical Association support the state's request that the U.S. District Court for the Central District of California Riverside Division dismiss the lawsuit, Palmer et al. Versus Bonta et al., and urge the court to uphold the law's constitutionality, as many courts have before. A hearing on a motion to dismiss the case is set for September 18th. So more to come on this.
That's Monday.
Yes. Physicians. I said this is hot off the press. This article came out. It says, so they must have, because I got it yesterday. but on here it says September 16th. No, it came out yesterday, September 15th. But they have, if you go to, and the links are in the description. There's an audio track, and so they may have updated the audio track. The audio track says September 16th. But anyway, it says physicians today are educated and trained differently and more deeply and robustly than any other professional healthcare provider in industry practice, and the law continues to place physicians at the center of medical care, the brief tells the court. As it was in the early part of the last century, the public continues to view physicians as the pillar of healthcare and closely associates the term doctor or doctor. So they wrote the word doctor, and then they have DR period doctor with physicians and surgeons. Patients, the AMA president, MDPH or MPH, Ehrenfeld, says patients want and deserve clarity and transparency in who is providing their care, as there are immense differences in the education, training, and qualifications among healthcare professionals. He noted that patients find it increasingly difficult to identify who is or who isn't a physician. The potential for confusion is especially heightened when non-physician healthcare professionals use terms that are customarily understood to refer to a physician. Truth in advertising laws, such as California's, have helped prevent this confusion, as well as potential harm to patients who may be misled into believing they are being treated by a physician when they are not. It is imperative that we follow precedent and keep these laws in place to ensure patients have the basic information they need to make informed decisions about their healthcare. And then they go on and on and on about their higher level of training. First of all, if somebody, let me just stop. Okay. And breathe. First of all, if I went and got my PhD in nurse care, ain't that a higher level of education than an MD? And sir and ma'am, you can call me Dr. Nurse if that makes you feel better. You can call me Dr. Nurse, but you gonna call me doctor.
Put some respect.
Respect. Oh my. Good morning. Lee Love 35. Good morning. Welcome. What in the world? Like, are you people in all kinds of professions are attained if they have PhD programs or doctorate programs or whatever, or doctorate of education, what they're called doctor. Period. What are y'all that insecure about? What that sounds like a level of insecurity to me. If you know your stuff and you operate in your stuff, then why do you care what somebody else? You know who you are and what you do and what you bring to the table. Why do you care about somebody else?
You know, the whole
I got mad that quick.
the whole theme today is what it has been for more than a year. It's gatekeeping. This is all it is. Like I mean, it is amazing how people want to be able to control what other people do. I've never seen it, and it seems like it's getting worse. Or maybe I'm just realizing now, but it's just like, how in the world? Why are you so insecure? Because that it speaks to a whole level of something else is going on, and you just really need to address the root issue, because this ain't it. Like, I just don't see what the problem is. And all I know is, just like you said, this is where it is for me. If someone has a PhD, put some respect on that name, period.
Yes.
End of story.
Yes. And don't miss me with my training. We've already identified. You all have already identified that there is a difference in the training. Right, wrong, or indifferent, there is a difference. because they can, and I haven't, let me just say, I haven't gone out to the other providers' websites to see what their counter is to the, oh, we have so much more training. You do medically. Do you got that same level of training at a bedside? Do you have that same level of training from that holistic perspective that the nurses bring? I would probably say no. But if I went and got my PhD in nursing or whatever, like, who's to say? And I think somewhere down in the article, they even talk about physician assistants. Yeah, I may be a physician assistant, but I may have gone on and got my PhD in something else. So then I'm a doctor, physician assistant, or whatever. Period. Period. And I don't think they're coming or trying to come across as being physician doctor. And I'm sure, most people tell you, no, I have my doctorate or I have my PhD or I have whatever. I'm not an MD. Because one, that's beneath me. No, I'm kidding. But I'm not an MD. I have my doctorate. So what in the world? I don't stay in your lane and stay out of other folks' business. Clean up your house.
Well,
the dust and cobwebs over there in their house. Clean up your house.
Well, what should happen, but I don't think it will, but what should happen is the nurse practitioners who have gone on to receive their PhDs should align with the physician's assistants, because the doctors are against physician's assistants changing their name to physician associate.
Yep. Yes, it's
so,
true. Worked hard for that title. Absolutely.
That's
probably even more in my feeling because I got my child. She getting her PhD. Don't play with her. She worked hard. I worked hard. I feel like part of that PhD is mine. My sleepless nights.
I just, with all that is going on, and I just think that honestly, the AMA has way bigger fish to fry to me.
Yes.
This is a waste of time. This is what you choose to focus on. I mean, you have you.
Oh, but trust and believe, because like in the next article, did you see how much money is being given out to these associations and whatever to help support this battle in the
yeah, because everything is about money, and this is whoever has the deepest pockets wins.
I was like, wow. So yeah, that one got me all up in arms. Then, and I didn't go out, and I haven't looked at the chart to see have any other states turned, because I know there were lots of states. But this said, and I didn't see this in this article. So this article, oh Lord, I'm about to butcher this name. Andis Robizniks came out again from the AMA Newswire, September 6th, how scope of practice expansion efforts were defeated in New York. But I didn't see where they were actually defeated when I read this article. So anyway, it says, so state legislators were inundated this year with inappropriate scope of practice bills seeking to allow, among many other things, nurse practitioners and physician assistants to practice without physician supervision, let psychologists prescribe drugs, permit optometrists to perform eye surgery, and allow pharmacists to treat illnesses. Must come to an end. Anyway, the Medical Society of the State of New York, MSSNY, collaborated with numerous state specialty societies to defeat some 15 scope of practice expansions that were proposed in legislation or included in Governor Kathy Hochul's budget as she sought to extend, quote, flexibilities in physician assistant scope of practice that ended when the COVID-19 public health emergency expired. Her budget also included a proposal to let pharmacists order laboratory tests without physician coordination. So I didn't go out. I'll be transparent. I didn't go out to look. So they said they did 15, but how many did they actually do, and what passed and what didn't? That would be the better story for me. Tell it all.
But
if you don't tell it all.
That's right. But to me,
I feel like Usher. You gotta tell it.
Right.
You gotta tell it all. Go ahead.
You can't pick and choose because I remember because I was raising an eyebrow when they were allowing pharmacists to give COVID-19 vaccinations. I'm like, well, when did that happen? All right, so if you can allow that, then we also know I don't have a problem. Me personally, I don't have a problem with pharmacists ordering lab tests because pharmacists follow therapeutic requirements because everybody in what a hospital I cover, everybody that's on vancomycin is one of those very powerful antibiotics that you have to monitor the peak and trough. They don't do both anymore, but they monitor the therapeutic level of the drug to monitor for toxicity. And the pharmacist is all up and through.
Yep.
So it's not like they don't know what they're doing. It's all about control. I just don't get it because if you listen, because I'm just thinking that some of these smaller markets and some of these rural areas, if a pharmacist and a daggone nurse practitioner who has full practice authority can get together, they could really help impact the community.
You're absolutely correct.
So why not let them? At the end of the day, is about now. I'm not saying all you have to do is just regulate them like you regulate everybody else. If you out of pocket with what you're doing, then you should lose the authorization to do it. Period.
Exactly. You're absolutely
Just like they do with everybody else.
And put those restrictions in play. Make that be
That's right.
legislation, not necessarily to your favorite word, gatekeeping, and not allowing
exactly.
They say physicians' assistants are quote invaluable members of the coordinated medical team, but they have far more limited education and training compared to what we receive in medical school and residency. And that was from the MSSNY president Paul A. Pipia. And he wrote that to a letter to his colleagues. So please remind your legislators that patients are best served by a team-based approach with a skilled physician overseeing and guiding care, and urge them to oppose this legislation. Yeah. And then they said go ahead.
No, go ahead.
Then they said they have these partnerships. And so the AMA Scope of Practice Partnership is a coalition of 109 state medical associations, national medical specialty societies, and osteopathic organizations. Since its launch in 2007, the partnership has awarded more than $3.5 million in grants to member associations to fund advocacy tools and campaigns. This year, the AMA boosted its support of the AMA Scope of Practice Partnership to $300,000 a year and supported 14 state medical societies with grants. This is up from 9 in 2022. Y'all see this? Y'all see? Follow the money, y'all. Follow the money.
Always.
Follow the money. So the MSSNY used its grant to produce radio ads that played throughout the state, alerting voters to the scope of practice expansion proposals and calling out the differences in education and training. And that is underlined between physicians and non-physicians, such as physician assistants and pharmacists. Mm-hmm. Mm-hmm. Yeah. And then they are all up in arms again about the psychologist prescribing bill. They caution that granting prescriptive authorities to psychologists is a misguided and dangerous solution for improving access to mental health services in New York. They all over the place. So yeah.
I mean, they act like, well, it's all a part of spin because they're trying to act like these people are not required to take or to have additional training to do those things. It's not like, oh, well, you graduate with your degree in psychology, you can write prescriptions. It's not that simple.
No, of course not. And I'm
And
sure there are additional training that um, that they have gone through in order to feel qualified enough to make those decisions. And again, to me, write the regulations as such. You must have XYZ in order to be able to do. Not all psychologists probably even want to be bothered with that. Like I don't want them kind of problems, because with
right,
those problems come probably higher malpractice insurance or whatever. Like you don't want them
exactly.
kind of problems. So, but for those who feel compelled and those who feel that they have the knowledge and skill level to be able to do that, why not allow them to do it?
And it's just like,
They hang themselves or
right.
whatever, but give them the rope.
And it should be, but you know what it all comes down to. I want to make 2 points about um education. I think the public is not educated on any of this, and it's, and that's where these associations become dangerous, because then they can push out a narrative because they have the money and the means to do it.
You're right.
So when it comes to prescriptions and prescriptive ability, all doctors cannot write for all classes of drugs.
Exactly.
So you have to go and obtain credentials and experience to be able to write for certain classes of drugs. And it should be the same for psychologists, because there are some medications that you do, like there's a psych medication, Clozaril. You have to have weekly white blood count lab work along with, and it has to be sent to the pharmacist in order for them to fill your prescription. So there would be certain classes of drugs that a psychologist would not be able to write for. I don't even think they would have an issue. So, and then the other point I want to make about education is, like, people want to act like these providers are these physicians are the end all be all, but physicians don't even take nutrition. They don't. So I don't think that people understand, because they're not on the side of healthcare that we're on. They don't see the back end. How all these services that people deem unnecessary, or like these physicians basically look down on, but they follow every recommendation. Like, I have not sent a provider a query from a dietitian that they didn't approve. Whatever the dietitian says, that's what they say. Okay. Oh, the dietitian says they have severe malnutrition. Okay, well, they have severe malnutrition. How do you know? You never took nutrition, but yet and still, they act like they are the end all be all, but they have a whole team to make them look like the king that they think they are.
And that's the truth. I was just having this conversation with somebody the other day. It's like, if you notice, yes, ultimately the physician is in most cases, and I'm thinking, in hospital settings, inpatient settings, and I guess outpatient settings as well, but I definitely in inpatient settings, ultimately the physician is making the decisions around the care, but they don't make those decisions independent of the rest of the team. 9 times out of 10, they gonna ask, well, nurse, what's going on? This and the third. They want to know, well, what they're seeing, this and the third. They're looking at the lab values, they're looking at radiology, they're looking at having other conversations with other members of the team to find out, well, what is happening, because they only come in and pop in and see that patient for about 5 minutes, if that. So they're relying on the data given to them and the information given to them from their team. Sometimes you have some physicians who will even ask, well, what do you think? What are your thoughts about XYZ? And the people that they're asking are not physicians at all. Or
That's right.
somebody might come in and say, you know what, doc, this, that, and the third, blah, 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 blah. You may want to check this or look at this, because I'm seeing that so and so and so. It's something that over their head ain't even thought about. Oh, you might be right. So and so and so, la, 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 la. So keep it a buck. For real, for real. They smart enough to give you the information to make the decision you need, but ain't smart enough to be able to flourish in their respective profession. Come on, y'all.
And but once again, people don't know because they're not on this side. There are doctors who are working right now, and they have a career and a job right now because of somebody, quote unquote, under them. I know we've been in healthcare for a long time, and I know a couple of instances I can count off on off the top of my head where nurses have told doctors this strength is too strong. This is not the recommended dose, or this is like I remember a doctor was going to have written an order for a drug that was 10 times the normal amount, and the nurse caught it. So these people but it's all messaging. People don't know because I have a very close friend who wants no parts of a nurse practitioner, and I'm like saying to her, I'm like, I mean that's your opinion, but like you're thinking that this person is less qualified. I said you don't know what that person knows, and you don't know if your doctor knows as much as you think they know. I mean, she's relatively healthy, so it's not like you need some top neurologist in the country. And I mean, and the app,
they ain't gonna see you no way. But that's a
period. Exactly.
They don't
that's
want
a whole
you.
nother. Yeah.
They don't want you at all. So, and to that point, if you feel strongly in that area that's not for you, fine. It might be for somebody else. So allow the option. That's all I'm saying. Allow the option.
Exactly.
Why fight the option? Because if you do it, I feel like this, and that's from the heart. If I feel like I'm doing what I'm supposed to do, I don't have time to be worried about what you're doing over there. I'm not looking for you. I'm not checking for you. I'm not doing any of that. I'm moving and doing what I'm supposed to do. Period. And good luck. I wish you well over here on your side, but I'm not gonna try to be like, you know what? I'm the only game in town. You should only do. We can talk about that even with medical. I'm the only game in town. I'm the only one that needs to do. You should just come to me. Forget this. They not qualified. They ain't been in the game longer than me. They don't. What? My thing is, hey, congratulations, you have an option. Because I tell folks all the time, I may not be for you. It's hard over here in these streets. I may not be for you. I have a goal, and that goal is to get you to the other side. Blood, sweat, and tears. It's like running laps. Blood, sweat, and tears. We getting over there, but you got to work for it. These people may not allow. They may not have that same kind of rigor imposed into their program. But I'm not gonna knock it. I'm somebody else's hustle, sir and ma'am. Do you get it? Fact. Because it's an option. There are options. So I can't be focused on what somebody else has going on that may be similar. And I've seen this, and I say this all the time. You bring your own uniqueness into whatever it is you're doing. Two people can be doing the exact same thing, but there are going to be differences because the people that are doing it are different, and they bring their own unique stuff to it. Period. And what may be good for one, or somebody likes, they might not like the other, and that's fine. But at the end of the day, you got a choice. You have options, and I think that's really the whole point. Let the folks have the option. Why are you trying to shut that down?
Because that's the whole purpose of gatekeeping. Yeah. That's its function, to limit choices and to make them the arbiter of options.
A mess.
But hey, look, they're the only ones that make compassionate sacrifice. The rest of us are just playing around.
We just playing around.
Mm-hmm.
Oh, good Lord.
Well, this was a lively discussion.
It was, wasn't
it? We got the Metamucil Mafia. We got compassionate sacrifice.
I'm gonna figure a way to cut that, and that's gonna be the next the Metamucil Mafia, baby. When I tell you. That tickled my spirit. Between that and trying to understand the whole fan situation, I am still tickled in the rest of this weekend. Trying to understand. Whew. So
Because I'm
yeah.
telling you, I don't know, Joel Osteen, they don't use no fan.
Well, maybe they got it ice cold over there and they don't need it. I don't know. You
I
gonna have
mean,
me watching the episode of Joel when they pan in the audience. Like, do I see a fan anywhere? Is there a fan?
I'm
Do the
telling you, like
ushers in the aisles with fans?
exactly, like on TBN, I ain't seen none of them.
Well, do they have them in? Look, now that you mentioned it, any mega church, is that a small church problem?
I don't know.
I'm
I
trying to
don't know.
think. If I seen TD Jakes, is there a fan
Th-
person in TD Jakes church? Do
Yeah,
you
that's
see?
true at the Potter's house. I wonder.
Do you see a fan in the Potter's house? Do you see the folks walking down the aisles with
But you
fans?
know what though? I think it's really more like now it's like a function of design because now they don't have pews, they have chairs. And because in the back of the pew was a little ledge where they had like the little hymnals and they had the fans in there.
But you
So
have the ushers come down the aisle with the fans to see if people need
yeah,
them.
but you had a place to put it. But most people just put it in that little thingy right in front of them when they left. Or because yeah,
Maybe
but
they
then
don't
I
want
guess they
maybe that's
but
that's efficient. I don't know.
I guess that I don't know because there's I wanted. You know what? We should get funding for a documentary. What happened to the church fan? That would be interesting. What happened to the church fan? I bet you PBS will sponsor it.
Wait a minute. Patreons need to come in and sponsor a documentary on what happened to the church fans.
It just occurred to me, like, because now we realize it is really extinct. And it used to be everywhere.
Everywhere. Everywhere. See what happens? Well, see how our mind works. Now we got to do the research, come up with the history of the church fan, where it came from, all of it.
Yes. See now, look, and then now look, I'm getting my Final Cut Pro.
And they need to spend some money. I bet you they can put all their little scope creep information on the church fan and pass it out to that's how you get folks. Don't hello.
You know what? See,
can you send me a grant? I'll help disperse.
See, look, now you really talking.
Listener people, y'all want to put y'all points out there? Physician assistants, y'all want to put y'all search out there? Y'all better put it on the church fan. Get it to the people.
Yeah, I'm telling you. Because that was part of it. It was part function and part advertising.
It was part
because it was always a bit
so you
exactly
knew who to go to. You knew what funeral home you needed to go
to. You know what? Maybe that might be the link. Maybe the people who were advertising, they always paid for the church fan.
Mm-hmm.
Maybe.
Mm-hmm.
All right.
They would drop off because these round. Look, I'm gonna tell you, I covered these up, but these round fans got one of them people, one of them groups that you done mentioned previously in your career. I'll say that.
See, I didn't already start
meeting after the meeting.
Okay. See, I didn't already. Lord. This is interesting. That's all I can say right now. It's interesting.
Look, when I want folks, because I thought about it, like, oh, what I want folks to do, I'm actually in the process of putting together. I created some fans for a dance group that I'm affiliated with, and it was loosely based off of a politician and some fans that she had, and I was like, who did that? And so she gave me the information. I was like, you know me, I'm gonna make something work. And I was like, oh, so I put them together for the dance group, and I was like, oh, wait a minute, this is advertisement. So I put some more together for my line dance classes. Like, we hot, you need a fan, here's here's the information. So I'll contact information if you want to know more about the line dancing. So I was like, oh, so that's how you get the information and your communication out.
I tell you, this is what happens when great minds come together. We are going to reintroduce the church fan.
Church fans. We're gonna be dropping them off at everybody's churches. They'll be like, well, where do you get that from?
Exactly.
And it's not like it costs a gazillion dollars to make. You get a ream of paper and you buy some sticks and you glue them together. Come on now.
I tell you.
I cannot. Ooh, I love the documentary though. That right there just to tickle you have really tickled my spirit today when I used her, because I could just see like the panning in. Where is it? Church fans laying on the ground. Where is
and like that little number you play for the church announcements, that could be like in the opening credits, and then you have a like you can pay into like a little church audience where they rock it back and forth, and it's just I don't know. And then I don't come on, but
it's going down.
Look, and I'm perfecting my Final Cut Pro editing skills.
No,
listen,
you did that thing. Now that you did that thing. I can see us be like Spike Lee using that credit card to start that first film.
Look, we could do our own. She's got to have it. A church fan.
She's got to have a church fan. Oh my goodness! See, this is some of the foolery that you get at the meeting.
Oh Lord!
Oh my God. Okay. Woo. All right. So we are at the top of the hour. Oh, bless our whole soul and hearts. I love it. I love it. All right. All right. So thank you all again for joining the Saturday morning tea or checking out the replay. I hope this has brought you joy as it has brought me.
Yes.
So was the tea spilled today? I believe
absolutely,
so.
Yes.
I believe so. All kinds of tea. If this information was valuable for you, then help us share this message with others by sharing the video. We also would encourage you to subscribe to the channel to continue to receive this type of content. Be sure to follow us for more information on all things health information, compliance, revenue cycle, medical coding, and now church vans. And where did they go? As you leave out, don't forget to hit the thumbs up or like button. And also don't forget to check out the Coding Nurse channel on YouTube. There are gems dropped over there. You see how this mind works. So he has some gems over there as well. Oh, this has been great. This has been great. Thank you all for joining. And remember, be safe, be kind, and don't wish for it, work for it. Until next time, next week. Take care and make it a great weekend.
Bye, everybody.